The NHS long-term vision has promoted a position of first-time, right-time diagnostics, and they've recognised that in order to do that, they need access to the facilities, to the latest equipment and informatics, but they need to look again at the workflow.
Healthcare today is far too reactive. We respond to late-stage disease, and in part that relates to the fact that we have a terrible shortage in the UK of diagnostic equipment. What we really need is a much more proactive approach, diagnosing disease much earlier.
There's a huge gap between the available capacity and the demand that we have now, and the demand which is growing. Philips and Rutherford Diagnostics have come together to build 5 community diagnostic centres in England.
What community diagnostic centres allow us to do is to deliver right first time diagnosis leading to treatment to patients in a setting that's easier to access for them and it's closer to their home. One of the unique propositions of the Philips partnership approach with Rutherford Diagnostics is we're able to offer a model that allows an NHS organisation to provide a community diagnostic space with the funding taken care of through a private partner.
Philips initially set up that partnership with Philips bringing the very latest in technology, the very latest in informatics, potentially in the future the use of augmented and artificial intelligence and screening techniques. We saw in Rutherford the ability to create exceptional care.
Typically, private sector organisations work in isolation from the NHS. We work in partnership with the NHS. Now, what that means in reality is that we'll have a cooperative, a sharing arrangement around staffing these centres. We'll also encourage training through the centres, something that typically the private sector hasn't done. The approach at Rutherford Diagnostics is to work alongside the Trust to actually design a facility that meets their population's needs, so it's bespoke each time.
CDCs will allow for the less acute work to be offered. It will allow for us to develop new services, so we can see there being lots of opportunity to extend these NHS services to include primary care, potentially GP services, teledentistry, imaging, oncology services, cardiovascular services and education services. And that's just the beginning of a whole series of further services that we will develop in partnership with our local NHS.
This is a really exciting time for me. I'm convinced that the partnership between Philips and Rutherford Diagnostics is going to create a really compelling vision for the diagnostic landscape in England. Ultimately, it's going to improve patient outcomes and experience.
It's truly exciting to be working at Rutherford Diagnostics right now, to be delivering community diagnostic centres alongside NHS partners for the benefit of the entire population, to really change the face of diagnostics here in the UK.
Innovation and you, Philips.